All right, so heart disease is the leading cause of death for both men and women and is responsible for about 1 in every 4 deaths in the country. But it's never too late to make lifestyle changes that can help prevent heart disease. So joining us during American Heart Month is to talk about some of those changes, cardiologist Dr. Giesler from Seton Heart Institute. So you and I were just chatting, and I was going over some of the things we're going to be discussing today, and you were saying that there are some new tips for keeping our hearts healthy.
There are some new tips. First of all, the old tips are healthy lifestyle and then knowing your numbers. And so part of the numbers to know are your blood pressure and your cholesterol. And so some of the newer evidence is that we need to be very aggressive in treating blood pressure. So we used to say start treating at 140/90, and now the recommendations are to do something starting at 130/80.
And talking about high blood pressure, something I feel like we hear all of the time, we're talking about health, but you're saying there's some new guidelines. They set some new guidelines on what exactly high blood pressure means.
Yes, so we used to say it was 140/90, and now the term high blood pressure applies to 130/80. And the recommendation is not necessarily to start medication at that point, but to intervene in some way. So start your healthy lifestyle habits.
All right, so what are some, obviously we know, like exercise, eating healthy, making sure you get breakfast in. What are some other tips that you have for?
So healthy lifestyle does mean eating well and exercising, but it also means no smoking, and it really also means moderating your stress levels, which is something that people don't always think about.
Probably the hardest of all is monitoring
absolutely.
your stress levels. You can see those up on the screen right now for you. Now, for Heart Health Month, what are some other things you want people to kind of keep in mind as well for keeping a healthy heart?
Well, I think that the thing about heart disease is that it is the #1 killer of men and women, but it's preventable. And so as long as you know your numbers and you're working on your lifestyle, that really makes a difference. And the other thing is it's treatable. So if you have heart disease, medications work, and intervening on your numbers really works. And the last thing is being aware of the signs and symptoms of a heart attack. Very often it's chest pressure, discomfort. It can radiate to the left arm, but often in women it radiates to the neck and jaw or back. So just being aware of the risks is super important.
Really? And you probably see a lot of people in Austin, I imagine. Do you feel like this is something you see more in our area, or because we're such an active community, not so much?
Well, you know, the interesting thing is sometimes in the winter months, if people are up shoveling snow, that brings on heart attacks. In Austin, stress, I think, plays a big role, and certainly the healthy lifestyle makes a difference, but we're seeing it more, and as the population here grows, so does the rate of heart disease.
All right, well, you gave us some good tips to keep in mind, important things to think about for your Saturday morning. You can find out more about this over at KXAN.com. There's the website up for you now. Doctor, thank you for joining us today.
Thanks for having me.